Welcome to Face It, the Aesthetics podcast. Today I've got Nurse Alice and I've got Nurse Susie. It is Acne Awareness Month for June and we're going to talk all things acne, treatments and prevention. Susie, let's talk acne.
Okay.
What are the causes of acne?
So usually hormonal changes. So whether it be puberty, menopausal, pregnancy, there's so many other things that can sort of flare up acne. Things like stress, when you're in flight or fight mode, your adrenal glands are pumping, and that adrenal gland activation will lead to more sebum, more oil in the skin, which can cause breakouts.
A lot of people think it sort of really targets and attacks the adolescents, which it does, but menopausal, hormone changes, women, and even men.
Yes.
So you just have done a consultation and a treatment, Alice, with regards to men and back acne.
Yeah.
So what you said that you mentioned about whey protein.
Yeah, it's just something that I've seen with patients coming into clinic to me, particularly young men or men that train in the gym quite a lot, and the correlation between whey acne or whey protein and acne.
Yeah.
So it's just a suggestion to try change up to like a vegan protein substitute or like a beef isolate.
Yes, just so that has a lot to do with
so much.
and breakouts. And you suffer it yourself.
Yeah.
Tell us about your sort of journey with it.
I struggled with acne when I was a teenager quite bad, and then it cleared up. And then once I had my 2 kids again, I've had a flare up. So I've tried many things, but I do think that it all comes down to your diet, what you put in, your water intake, and then a good, simple but active skincare. Yeah.
And you've came off your cream, is it you're using? So what is it you're going to be doing for the next? Because no, Dr. Arun was talking about he's going to try a different skin journey with you.
Yes, he is. So I have tried many a thing, and I decided just to come off tretinoin and give myself a little break. Tretinoin usually is amazing for treating acne. It's prescription retin A. And yeah, it's amazing for treating acne, but for me it just wasn't doing it. I think that I've potentially damaged my skin barrier from maybe using tretinoin too heavy.
Okay.
Which
a lot of people do. What how much is it? It is something I don't go near it, and I know everyone raves about it, but it is because
You need to be careful.
Yeah. And that's why it's so important to go to a medical professional with regards to doing that and getting that proper.
And that's why it's prescription.
Yeah.
this is
So
it.
it's a drug.
And it is very little that you need to use.
Oh
of
yeah,
it.
like pea-size amount on the skin. Like it's
Yeah.
like so little. So little.
And then you get carried away.
yeah, because
I think
if you
that's the
start
thing.
seeing results, then you're like, oh, put more on.
Yeah.
And then what happens? You get all the things that
That's
come
it.
with that.
But there are good things like Skin in Me is brilliant. They're like online prescription services
Okay.
that you can only twist. Like
Oh
using
yes, they give you a
daily
prescribed
doser.
amount.
Oh,
Yeah.
so it means will
Yeah.
never go over the.
Yeah.
Yeah.
The recommended daily dose.
So but they microdose it.
Yeah.
So it just depends. But yeah, as I said, I'm not knocking tretinoin because I have been a lover and I love it for loads of my patients. But for now, I'm going to trust Devisa and Dr. Arun to take me on a new skin journey.
And do you know what it is you're getting, or what's the first
Yeah,
step?
because we chatted
Be
about a
interested.
Lumiere, wasn't
Yeah.
it? We're just kind of stripping it right back.
Yeah, back to basics.
Yeah,
Back
just
to basics.
cleanser and probably an
Yeah.
exfoliant. And
Yeah.
are you going to do the retinol or are you going to keep it really simple?
It depends because I use quite a lot of like collagen induction, like injectable treatments on my face. So at the minute, I think I could afford to strip it back to the
Yeah.
basics, like, cleanser, moisturizer, SPF.
Yeah,
And then add actives in as needs be.
gradually and see how
Yeah.
your skin copes. Yeah.
So what other treatments is there for acne for anyone who's listening or watching?
I'd probably say chemical pills. Yeah,
Love a
chemical
It is the
pills.
best, but not during a flare up, obviously.
No, not during
Yeah.
a flare up. It's obviously whenever your skin's died down. If you're using, obviously there are things that you can go to your GP and get. So your antibiotics, tretinoin is a prescription as well. So if you're kind of not in a flare up of it, I would be recommending a course of pills.
That is,
Definitely.
and you would have to do, when you say a course, how many often before people start seeing changes?
You can see obviously a change after even one. It's going to be a minimal change, but I would say a course of 3.
Yeah,
three,
at
definitely.
least.
3
Yeah.
to start with.
Yeah.
And then what about maintenance?
I think once you get your acne under control, you just come in when you feel like you need it, like every few months, I would say. Yeah.
Yeah, as long as you've got a really good
Stabilised. Yeah.
stabilised home care.
Yes. It's your home care's
Because
key.
your home care is
is,
key, and then
yeah.
you're just topping up.
What
Yeah.
about microneedling? Because a lot of people say, you see a lot of the before and afters online for microneedling.
Yeah.
How effective is it?
Yeah,
scarring.
scarring. So if you've
brilliant.
had like real like ice pick or pitting scars, I would be recommending your microneedling
Yeah.
for treating that to try and get your flawless complexion back.
And then you have the polynucleotides that also do the scoring that
Yep.
you were saying.
Definitely,
Yeah.
yeah. No,
Yeah.
I love the polynucleotides for that.
Combined treatment.
Like it's
Yeah.
And
it's,
why, what exactly is it that the polynucleotides do?
Well, it helps the skin repair at a cellular level. So you're going in there, you can usually do a bit of subcision to break up the scar tissue and then inject the polynucleotides right down in to help that tissue repair.
Yeah.
So yeah, it's
It is very good.
Yeah.
And going back to the guys who suffer from the back acne, you know, all these treatments like the peel and stuff, we just done a peel on a patient that is going through the whole process, and we will have the before and afters once we finish. You know, men need to come in and get the consultation because you can address.
we can help. Yeah.
Yeah,
100%.
definitely.
Consultation. Start with the consultation, and we can just take it from there and recommend whatever treatments.
Yeah.
And you shouldn't feel worried about coming in and the stigma attached to it, because these guys
A lot more
deserve it.
men are coming in now,
Yep. Oh, yeah.
particularly with regards to, and because it is medical, you know, it's not a beauty salon they're coming
Yes.
into, it is an aesthetics,
Yep.
medical-led clinic.
Yep.
With
It's all about
the
results.
right expertise,
Yep.
and it isn't flowery or anything
Yep.
like that there or
Yep.
anything, you know, they
Yep.
feel very comfortable. And as I say, we've got doctors, we've got nurses, you know, we've got the right people to help all of them come in and do
Yep.
whatever needs to
Yep.
be addressed. So what else then when it comes to acne, when people talk about it or say it, you know, like what is the right age to start? Because we talk about adolescence and then you're hearing about hormonal changes
Yep.
where, you know, you're coming into the sort of late 40s, early 50s where
Yeah.
people, you know, women in particular through menopause are flaring up again. So what is the right age to start? And, you know, when they get a break, when is the right time to maybe address
I
all
would be
this?
saying, like, when it comes to skincare, if I could go back in time, I would have started my skincare a lot younger. Do you know, like proper skincare? I've always loved skincare, but was using stuff out of high street shops.
Yeah.
If I could go back in time, I would say like late teens, early 20s, come in, have a consultation and get started on proper skincare that you're going to see results from.
Yeah.
Because the earlier you start, you're preventing anything from
It is all about
happening.
prevention, isn't it?
Yeah.
And preventable
Yep.
care.
Yep.
Yeah, definitely.
Yep. Another thing actually just to add is, I don't know if you picked up earlier on about the patient that we had in was saying about how he had used sunbeds
Oh, right, okay. I
because
missed this
he
conversation.
he thought that was helping. Did you hear? Yeah. A lot of people have this misconception that they think that sunbeds will help their acne,
Yeah,
and it doesn't.
it doesn't. And why, so why is it? Why do they have that misconception?
I think there's always been a thing about the sun helping
Yeah.
spots.
Yeah,
It's
yeah.
always been, but it doesn't. So,
Yeah.
you know, and if anything, you're doing more damage. Like sunbeds are
Yeah.
really bad.
And
So they
it comes
are.
back to having your SPF and stuff like
Yes.
that on your
Yep.
face.
Yep.
Whereas if the sun did
Yes.
have that effect, then why
Yep.
would you be wearing your SPF? And it doesn't
Yep.
do that because then you're creating
Yep.
other issues that
Yeah.
coincide with
Yeah.
the issue that you have.
And I
Yeah.
think as well, when you're using products to treat acne, especially medical grade, you do need to be wearing that SPF
Yeah.
because they are so active. So you need to be, that's
That
all-
extra protection because
You
they're
really need to
they're
be.
making your skin more sensitive to the
so
sunlight.
when people come into me, I just are going to make sure first and foremost that they're compliant with their SPF.
Yeah, that they're going to actually use their SPF because there's no point in treating one concern and then you actually create another one because you've got your sun damage and
Yeah.
pigmentation if you're not using your SPF when you're using those active ingredients.
So talking about skincare, what's your go-to skincare product?
Oh,
One. You're only allowed one.
For acne,
Yeah.
Pore Therapy Obagi.
I agree with you on that one there as well. What about you, Susie?
for acne, probably a Lumiere's purifying cleanser, gel cleanser, because it's got salicylic acid in it, and it's going to be really good at helping, that bacteria that causes acne.
And I love the PCA skin peels. I think they're one of the best.
Yeah, I
For
love
somebody
them
who
too.
does, I have to be careful with, the peels that are out there, because I have reacted to peels in the past. I definitely would say PCA skin is definitely go to and a good beginner peel to
Start
go
now.
and do.
Definitely agree. Yeah.
Perfect. Well, thank you very much, girls. Stay tuned for our next episode.